Larimer County is committed to the health and well-being of its residents. And that means ensuring that we're protecting the vulnerable, helping people who are struggling become self-sufficient, and ensuring that the entire population is healthy. And although they serve all ages, there's a special emphasis on kids.
A baby that is born healthy has a much better opportunity for a healthy life. When they are given the kind of stimuli they need to grow and develop appropriately, they're better able to succeed in school, in life. There is a real economic side to that as well as the human side.
Since we are able to offer them healthy food and nutrition tips during pregnancy, we are seeing better birth outcomes, less premature deliveries, low birth weight infants. So we can really have an impact there, and it does save Medicaid dollars because there's less healthcare costs. So if we can help moms with nutrition and health tips early on, it will help their children to develop good food and nutrition habits. There's less chance of them maybe developing diabetes or heart disease later on.
You gotta let go, there you go. Everybody knows when you're around a kid and they get sick. Pretty much everybody gets sick. And if they've got a cold, you know, that's okay. But there's a lot of other diseases out there that can be much more serious for kids.
We do immunizations here for the Vaccines for Children program. Children who do not have insurance, who are underinsured, we want to make sure that no child develops a vaccine preventable disease because they seem to be more susceptible, more prone to complications from diseases.
Keeping kids healthy is one thing, but keeping them safe is also important. Sometimes the stress of life can really push parents and they forget why they became parents in the first place. That's when it's time for the county to step in and lend a hand.
Our main focus is to work with families to keep families safe and to keep children safe in their own communities. We work in a differential response philosophy, meaning that we respond to allegations of child abuse and neglect, working with the family to help keep the children in their home and also give the families and the parents support, because if we are not helping that family, then we're going to be looking for placement for that child. If we don't invest in children, especially when the family's in a moment of crisis, then we're not helping the community.
Families with kids aren't the only ones who need support. The fastest growing population in Larimer County is people over 65, and the Office on Aging has programs to help aging seniors and caregivers as well.
Our system really can't afford to make an assumption that everyone's going to be able to afford assisted living or skilled nursing level of care. And our public assistance programs really can't afford to have everyone go to that highest level of care. Not everyone needs that. So if we start looking at programs, start networking with other agencies and start finding those gaps in services, and as a community address where those gaps are, then as our population ages, it'll benefit the whole community.
While the county works with individuals on many levels, it's the goal of the health department to have an impact on people's lives by improving the health of the community as a whole. So in addition to holding immunization clinics when needed, or tracking West Nile virus,
air quality monitoring, water quality, zoonosis, which is diseases spread by animals, inspecting food establishment. We also do a lot of planning, training, and exercising around what we would do public health-wise in a disaster.